Does frequent alcohol consumption affect individuals who undergo hair transplantation?
If you have the willpower, significantly cutting back on smoking and drinking for about a week after surgery would be helpful.
There are so many clinics out there. For those of us like myself who are considering surgery, it would be incredibly helpful if you could offer a golden tip or piece of advice on how to select a clinic that's truly the best fit.
Each clinic has a very different consultation process. They tell you different things, and the prices vary so much, which can be quite overwhelming. But the one point I always personally emphasize is that you absolutely must meet the operating surgeon in person. I think that's what's important. No matter how big or fancy the clinic is, if you meet the surgeon who will operate on you and you don't feel you can trust them, then it would be wise to postpone the operation. Yet, if the clinic is modest and the doctor appears highly trustworthy and capable, that kind of faith is the origin of trust. And the significant advantage of directly meeting the operating surgeon is that you can inquire about things like the overall design and hair follicle density. The question I receive most often, particularly from younger individuals, concerns the number of years I've been performing hair transplantation. They ask, "Doctor, how long have you done hair transplantation?" I say, "A long time." I believe that asking such questions holds significant meaning. Therefore, if you're uncertain, I believe it's best to simply inquire straightforwardly. But truly, to speak frankly, with hair transplantation, sufficient experience isn't accumulated in just a year or two. Individuals with more experience generally perform much better. I believe that's the best way to express it.
So, if you look closely at my hairline, you'll notice it slightly recedes inward, correct? While I'm quite satisfied with this, some people might view it as too confined or perhaps a bit suffocating. However, from the standpoint of someone in the hair industry, there are practitioners who, instead of shaping it with an inward curve like this, opt to create a much more perpendicular straight line approach. When viewed from the front, since the face isn't a flat square but has curves, it makes the hairline appear more M-shaped, higher up. It truly does appear that way. While there isn't a definitive answer as to whether this design is the correct one, or if what I had done was right, I personally desired this outcome, and I am quite content with it. However, some have mentioned that it appears a bit stifling.
That's possible. It depends on who's looking. The reason for designing it that way is that we look closely at the shape and direction of the temples. Actually, if this area is your natural hairline, it's generally best to have that same shape reflected here. We align it with the face shape. When designing, both height and width are crucial, aren't they? Thus, the height and width are determined perhaps by using the nose's length as a reference. However, the precise configuration should indeed align with the patient's individual preferences. Whether it's angular or rounded, I always tell people it just has to please you personally. So design is paramount. Once established, densely implanting hair in that area is key.
Most often asked, how wide is your forehead?
Yes, right.
What's the best measurement? Typically, consultants often suggest that 7 to 7.5 centimeters is ideal. They refer to it as the golden facial balance. My forehead measures approximately 6 to 6.5 centimeters. The reason this holds considerable importance is that for individuals whose foreheads are naturally around 8 centimeters from birth, I've been informed that achieving a high hair density when attempting to lower the hairline to such an extent can be quite challenging. It's quite challenging, yes. So, while I don't see the huge significance of a specific centimeter measurement, people are intensely preoccupied with it.
In consultation, they ask, how many cm is this design? They always bring that up, but if it were me, this is my criterion. I use the area from the nose tip to the eyebrow sensor as a reference. On your own face, it just needs to be lower than this, always, but setting it at 50% would be too low. About 75 to 80% of that height is appropriate. For JSOM, perhaps 65%? I believe we aimed for around 70%. My idea was to lower it slightly and prioritize achieving a dense look. That was our strategy, and I never go as low as 50%. But the younger the patient, the more they want to lower and narrow the hairline. So the absolute centimeter measurement isn't that important, but you have to maintain facial balance, so getting that proportion right is a good idea.
For individuals experiencing both M-shaped hairline recession and crown hair loss, even with hair transplantation, there might not be sufficient hair follicles to fully address the M shape alone. Additionally, transplanting into the crown area when existing hair is still present isn't straightforward, is it? So for people in that situation, I would think that wearing a hairpiece might actually be a better option than getting a transplant.
But here's the thing. The front is a visible area regardless of treatment, so a hair transplant should be the main approach there, while the back calls for medication. For such situations, both medication and surgery should be recommended, and waiting too long must really be avoided, because hair loss has already been verified. So, whether you're taking medication and it continues, or you're not taking medication and it still progresses, it's crucial to proceed with surgery without delay to achieve a higher degree of satisfaction, because if you leave it, it will just keep progressing. That's why I recommend surgery. I would rather more boldly recommend both the surgery and additional medication treatment, as I often advise.
And when these hair follicles grow out, they often come in somewhat wavy or even a little curly. The rest of my hair is straight, but the front is curly, so it looks kind of messy. But from my work, I've noticed that for people who are 3 or 4 years post-op, the hair just becomes like their natural hair. So I'm curious if this has a specific cycle or if it simply differs from person to person.
It varies by patient, but your hair, JSSAEM, returns to its original thickness quite early. Thus, there are two primary reasons for hair growing curly post-implantation. Initially, the hair root hasn't yet fully matured, meaning it cannot attain its natural thickness. This results in alternating thick and thin strands, giving it a curly appearance. The other reason is when the depth adjustment during implantation was wrong. If it's too deep, the hair can curl as it grows out. So, if the transplant was done with the wrong depth, then all of those hairs really need to be removed. However, if the depth was properly adjusted during transplantation, but the hair appears curly because the blood flow isn't yet fully established, or the hair follicles aren't completely mature, then as you mentioned, by the 1, 2, or 3 year mark, you'll see the curls begin to straighten out around the 1.5 year point. Exactly. So by the 2nd or 3rd year, it regains its original texture. That's why with hair transplantation, you need to take a long-term view. That's the only way to judge the results properly.
One of my clients had a transplant and only about 10 strands grew in. Only that much hair grew out. The individual likely spent around 5 to 7 million won for their hair transplantation. In such cases, should they pursue a revision surgery at the same clinic, or is it better to seek one elsewhere? Furthermore, do situations involving refunds ever occur? Are such options available to patients?
As you're aware, hair transplantation results differ significantly, so there isn't one definitive solution. However, if you maintain confidence in that clinic and the operating surgeon, it could be beneficial to attempt it there again, provided you receive a thorough explanation. If you can fully understand and accept why your results turned out the way they did, you'll probably trust them to handle it again. But if you feel like, this is strange, I just don't get it, then it might be best to take your current situation and get another consultation at a different clinic. It's a somewhat cautious answer, I know. But if the density is poor or the design isn't to your liking, going back to the same doctor at that particular clinic could very likely lead to the same outcome again, couldn't it? So if you truly trust them and you can think of a reason why your own result might have been poor, then perhaps you might put your trust in them one more time. However, if that's not the case, consulting other hospitals might reveal new insights or information. You should take what you perceive as problematic, go back to your doctor, ask questions to clarify, and then make a final decision. However, if that trust still exists, it's appropriate to have the surgery there. If not, considering another clinic isn't a bad idea, and usually in cases like that, most clinics do have policies for partial or full refunds. There are specific regulations in place, thus you should make sure to contact the clinic again to verify this information thoroughly. To get better results quickly, I think it's better to do your homework and shop around.
But after the hair transplantation, you have to wait at least a year to see the progress, which is quite a significant amount of time, wouldn't you agree? That means you have to go through another rough patch until then. And you have to deal with the itchy scalp and all that again, so people are hesitant to make that decision. Some just say, since it's already like this, I'll just simply live with it. Some people say, I'll get a touch-up later. It just seems to turn out that way. They invested time before, but when the value isn't there, their motivation drops significantly.
When the surgery itself went well, but the results are poor, patients can feel a sense of self-defeat, you could say. Or they might briefly accept their fate as inevitable. They might think, I knew this would happen after my surgery. This negative mindset often causes their confidence to plummet even further. Therefore, some people might firmly conclude that going elsewhere won't improve things. However, undergoing the procedure when you are younger, even by just a year, generally yields better outcomes. And if the surgery was unsuccessful, there are definitely some methods to make improvements. So don't get too discouraged. It's best to look for a solution.
I'm curious about something. I have photos from your surgeries, and what I've noticed is that the density is high at the front and then gradually becomes very natural towards the back. However, when I look at other clinics' results, the density seems to be uniformly and naturally distributed across the entire area, not just in specific sections. Is this approach your unique expertise, your own special know-how?
You must implant thinner hair more densely, requiring closer spacing. If the hair already possesses decent thickness and appears acceptable, you can plant it more uniformly. However, certain areas often exhibit concentrations of fine hair. In those spots, you have to implant thicker hair. So not only is the visible density different, but we actually vary the thickness of the implanted hair follicles. We do that on purpose.
Looking at results, they're truly diverse. Each clinic has a distinct feel and different hairline. That's correct. Given that an individual manually performs the hair transplantation, the specific tool used, such as an implanter pen, might not seem vitally important. Nevertheless, numerous individuals frequently inquire about such details. That's right, the slit method. I also heard of a method where nurses make incisions and insert each hair one by one. I don't think saying one method is definitively better is all that important.
I share a similar viewpoint. The most crucial aspect, in my opinion, is to personally consult with the operating surgeon and assess their level of dedication and engagement throughout the entire surgical procedure. Today, Jae-sem and I talked about some common questions regarding hair transplantation. I hope this was helpful. Thank you.
Thank you.